We've heard your questions about the new Medicare GLP-1 Bridge program. Do I qualify? How much does it cost? Does it work through my Medicare Part D prescription drug coverage? Well, today we're going to answer all of those questions for you and go over exactly how the Medicare Bridge program will work. My name is Hannah Skinner, and I'm a licensed insurance agent with the Senior Savings Network. Make sure to comment below any questions that you have that aren't answered in this video, and subscribe to our channel to stay informed on what's going on with Medicare. Let's go ahead and get started. So what is the Medicare GLP-1 Bridge program? The program is a temporary demonstration created by the Centers for Medicare and Medicaid Services, also called CMS. It began on July 1st of 2026 and is currently scheduled to run through December 31st of 2027. The goal is simple: to give certain Medicare beneficiaries access to GLP-1 medications for weight loss and weight maintenance. This is huge, as Medicare generally does not cover drugs related to obesity. Question 2, is everyone on Medicare eligible? Short answer is no. Not every Medicare beneficiary qualifies. To be eligible, you must be enrolled in Medicare drug coverage either through a Medicare Advantage plan or a Part D prescription plan. You must be prescribed a GLP-1 specifically for weight management, meet the program's medical eligibility requirements, and have your provider submit required prior authorization. Question 3, which Medicare plans qualify? Most people with standard Medicare drug coverage are eligible to apply. This includes people enrolled in standalone Medicare Part D prescription drug coverage, Medicare Advantage plans that include prescription drug coverage including HMOs, HMO-POS plans, local PPOs, and regional PPOs. The program also includes special needs plans, also known as SNPs, employer and union group waiver plans, the LI NET program, and dual eligible beneficiaries as long as they're enrolled in an eligible Part D plan and meet the clinical requirements. However, some Medicare plan types are not eligible, including private fee-for-service plans, Section 1876 cost plans, Section 1833 healthcare prepayment plans, PACE organizations, fallback plans, and religious fraternal benefits plans. The exception is if someone enrolled in these types of plans also has a standalone Part D prescription plan that qualifies. Number 4, which GLP-1 medications are covered? The Bridge program currently covers Foundayo, Wegovy injections, Wegovy tablets, and Zepbound quick pens specifically. Keep in mind that CMS can update this list over time, but these are the medications that are currently included. Question 5, how do I enroll? You cannot enroll yourself. Instead, your doctor or qualified medical provider must prescribe one of the eligible GLP medications and submit a prior authorization request. They must also certify that you're using the medication as part of a lifestyle program that includes diet and exercise. CMS encourages providers to submit prior authorization electronically, although fax submissions are also accepted. Question 6, what medical conditions qualify? This program is designed specifically for weight management. You must be at least 18 years old and you must meet one of these clinical requirements before you begin therapy. You must have a BMI of 35 or higher, have a BMI between 30 and 34.99, plus at least one of these conditions, including heart failure with preserved ejection fraction, uncontrolled high blood pressure, stage 3A or higher chronic kidney disease, prediabetes, previous heart attack, previous stroke, or symptomatic peripheral artery disease. You're also eligible if you have a BMI between 27 and 29.99 if you have one of these conditions: prediabetes, a previous heart attack, previous stroke, or symptomatic peripheral artery disease. Number 7, what if I'm taking a GLP-1 for something besides weight loss? This is one of the biggest points of confusion. If you're taking a GLP-1 medication for conditions that are already covered by Medicare Part D, then you do not qualify for the Bridge program. That includes medications prescribed for type 2 diabetes, moderate to severe obstructive sleep apnea, other FDA-approved uses that Medicare Part D already covers, such as Wegovy, for reducing cardiovascular risk in certain patients. In these situations, your medications should continue to be covered through your regular Medicare Part D prescription drug plan or Medicare Advantage plan, not through the Bridge program. The Bridge program is intended for people using these medications specifically for weight reduction or maintaining weight loss. Question 8. How much does it cost? Eligible beneficiaries will pay a flat $50 copay per month. You'll pay that copay directly at the pharmacy when you pick up your medication. Question 9. Does the $50 copay count towards my Part D deductible or maximum out-of-pocket spending? No. This is one of the most important things to understand. The Medicare GLP-1 program operates outside of your Medicare Part D prescription benefit. That means the $50 copay does not count towards your Part D deductible, and it does not count towards your annual out-of-pocket spending. It also does not count towards your true out-of-pocket cost. So in short, it does not count towards your covered prescription cost. No matter what phase of your Part D drug coverage that you're in, the Bridge program copay remains $50. Even beneficiaries receiving extra help or other low-income subsidies will still pay the program's $50 copay because these subsidies do not apply to the Bridge program. Number 10, who's actually paying for this medication? The medications are being provided through participating drug manufacturers. CMS negotiated a net price of $245 per monthly supply of eligible GLP-1 medications. The Bridge program administers separately from Medicare Part D. CMS is using Humana through the existing LINet infrastructure to process claims for the program nationwide. Question 11. What happens after my doctor submits the paperwork? Once your doctor submits the prescription and your prior authorization, your pharmacy may ask you for your Medicare number or at least the last 4 digits of your Social Security number to process the claim. If you're approved, you'll receive a letter in the mail confirming that your medication is covered through the Medicare GLP-1 Bridge program. Your approval, including refills and dose changes, will be valid through December 31st of 2027 unless you switch to a different GLP-1 medication, in which case a new prior authorization may be required. Question 12. What if I think someone is trying to scam me? Because this is a new Medicare program, it's important to stay alert for fraud. Your pharmacy may legitimately request your Medicare number or the last 4 of your Social Security number to process your prescription. However, if something doesn't seem right, contact 1-800-MEDICARE or report suspected Medicare fraud to Medicare's official reporting channels. The Medicare GLP-1 program is one of the biggest changes we've seen in Medicare prescription drug coverage for weight management. But remember, this program is temporary, has eligibility requirements, and operates completely separately from your Medicare Part D prescription drug plan. If you're wondering whether you'll qualify, talk to your healthcare professional to determine whether you meet the critical criteria or whether this program is appropriate for you. If this video helped you understand the new Medicare GLP-1 program a little bit more, give it a thumbs up, subscribe to our channel, and turn on our notifications. We post weekly videos about Medicare news and policy changes so that you can stay informed and make confident health decisions. And as always, if you'd like help reviewing your Medicare coverage, please call our office at the number listed below. Our services are completely free and we work for you. Thanks for watching, and we'll see you in the next video.